Welcome back to the Resurgence Athletics podcast. This is episode 12. My name is Dr. Ryan Goodell,
And my name's Dr. Lucas Noguera.
and we're back with red light therapy.
Let's do it.
This is something I've seen more recently. It's
Yeah.
starting to become more popular. We're just going to hop right into it today.
All right.
Yeah. So, red light therapy. Do you want to explain a little bit about what red light therapy is? I know a couple people come into our clinic, they ask about it. Some people at the gym that we're at bring it up. And it's something that we see commercially and also in medical offices. So there's a little bit to touch on there. But do you want to explain to everybody what red light therapy is?
Sure, I'll try my best. It's just basically another modality that we have available, right? It helps with recovery and healing. So some studies have shown that it can kind of speed that process up. And what essentially it does is it sends wavelengths of this red light or the infralight into or penetrates through the skin, which then will get absorbed by the mitochondria, which will then increase the number of ATP and whatnot in the cell, which would also in turn then help with reduced inflammation.
Essentially, just like light is very similar to like UV radiation and like all these other wavelengths that I think that people are like familiar with, right? And red light, blue light, all the whole light spectrum they all have different wavelengths, right? So that's where we get a lot of the names from different wavelengths. This is just on the red light wavelength spectrum or the near infrared below the red light spectrum. And the wavelength has a depth that it will penetrate into our skin. So that's kind of how like light and wavelengths work. Ultrasound kind of works in the same way. So does like everything has a wavelength and a frequency to it. So it's not just like all magic sciencey stuff, right? There's some actual science to it, which gets into like the physics of like how wavelengths work. What they do in our bodies are a little different. Like we know IV or ultraviolet rays can damage our skin. We have X-rays, which give us imaging. So, people have been using different wavelengths for different things. And, even radio frequencies. That's how we send audio through the air and things like that. So wavelengths there's like a legitimate science around wavelengths and penetration of like a wavelength into an object. So that's kind of how the red light works, right? And depending on the parameter of the wavelength, so this is pretty much between like 600 nanometers, super, super tiny, and 1,000 nanometers, is going to somewhere in there, the 600 to like 800 range only penetrates a depth of like, a couple millimeters?
Like 1 to 3, I think I read on one of the articles.
And then as you get closer towards 1,000 nanometers, the wavelength penetration gets deeper. Right. So that's kind of how red light therapy works. And when it interacts in the cell, that is something different. So the wavelength size is going to dictate how deep it penetrates into the tissue. And then once it's in there, what is it doing? Right. That's really the crux of this whole thing. So there are some conditions that red light is used for. We can go over a couple of those. Like what are just a couple of those off the top of our head here?
I mean, we know it's used for like skin health. So wrinkles, if anyone's struggling with that, sometimes that'll help with the collagen and, not having as many as those aging effects.
Right. And you see that with, I think the most notable one is the Therabody, the like Darth Vader mask looking thing. You're looking like a stormtrooper walking
Halloween
around.
Costume,
I've seen those all over social media. People making fun of how those look when you're wearing them around.
Not pleasant.
No, not a great look. But
I guess if it works, it works, right?
So skin health is one of the things, right? And so there are things that are available commercially. There's stuff that you can probably only get in like a medical office. But another thing that they use them for is wound healing. But those are like superficial wounds, right? So like certain wavelengths are going to affect that, right?
Probably be more.
But I think to the extent of that, right? it's not going to help with like infected wounds or like reasons why you might have like a wound in the first place. So even with wound care, it has to be super specific around why you're actually using it and what other things are going on too.
Definitely.
You know, so it can help with some wound healing. And then another thing that it's commonly used for is pain relief and inflammation, which kind of gets more into our realm, right? And there's a lot of claims out there about those things, and we'll dive in a little bit later about like factuality of what those things are. Even more so, you see athletes trying to use it now with like muscle recovery and performance effects. And there's even some preliminary research that's hard to say today about red light's effects and traumatic brain injuries. That is newer research. I think that's coming about, but if that could potentially be something, I mean, that's a whole different discussion, but that is an area that they're also looking at red light therapy for, because those things are hard to treat, and the fact that it I must emphasize on brain injuries and CTE might have some effect there, but they're still looking into that. That's a long way off from being definitive. That gets us to our next question. Are there any proven benefits to using the red light therapy for like muscle recovery and pain relief? We're going to focus on that right now. Pull a muscle, right?
Yeah.
Do I need to be using red light therapy?
You don't need to be. It would be an adjunct treatment to whatever the gold standard is that we're already using in the clinic. So it doesn't, you can't just not go through your corrective exercises, some of the hands-on techniques that we do in the clinic. You can't just, take that out of the equation and expect this red light to be just a miracle, right? So I think that it has to be in addition to whatever we are already doing to heal that affected tissue.
That's a really important thing to note, because just because we have these things, you also have to compare them against the standard level of care that, like, what is the current gold standard? And is this thing better than, equivalent to, or less than what that standard is?
Yeah.
Because you don't want to take away something that could be potentially more effective to add in something.
Exactly.
Like if you only have a certain amount of time to dedicate to this, recovery process, or putting time into your therapy every day or something like that, you don't want to like cut it short to add this in when it's a less effective way of doing things. That kind of gets into like what athletes doing. Like it's circumstance, and it's like what you need to be doing, how much time you have available. Athletes, that is their job.
That's their bread and butter, yeah.
So if you need to spend 2 to 3 hours a day on training and recovery and mobility and all of these things, like that is your job at that point. So this could potentially be like a really beneficial thing if you've exhausted the amount that you want to train for the day, and you can like lay there and maybe like just blast yourself with some red light for a little while. Maybe it helps you recover a little bit faster, but again, there's other modalities too. And is this the thing that's going to work for you? Is it something you want to do? Is it the time that you want to commit to it? That's all a factor.
And even with my patients, I wouldn't, like you said, I wouldn't want to take away what we're already doing. So say if we had to condense a session to add in this, red light, I wouldn't want to take away from what we're already doing. So it would only be like if that individual has the time, the extra 10, 20, whatever parameters it might be, to do it at the end of our session, sure. I think it could be a great addition, but just not taking away what we're already doing.
Yeah, and with anything, red light therapy, whatever other thing is the trending thing at the moment, there's always unrealistic expectations. I think sometimes like there's no magic bullet thing that's gonna cure you for a hamstring strain, or like
would be nice.
You tore your rotator cuff or what have you. So with red light therapy, I think there's some misconceptions or some unrealistic expectations of what it can do. I just think like one of those off the top of my head is that it's going to just rid you of whatever that thing is, like immediately. Like a lot of the research that we looked at when we were like looking into this topic you know, they're chronic effects, and those are over the course of like anywhere from 2 to 12, maybe beyond, to get the effects from this thing. So at that point, you're looking at the time frame, and it's like, is it the natural time course of healing?
Yeah.
Was it the actual like therapy, the meat and potatoes of what we were doing?
Yeah.
You know, was this contributing to maybe a faster recovery process? It's hard to tell in that regard, because if you look at it in isolation, you know, maybe it can do some things, but in adjunctive to what you're doing, did it statistically significantly make you heal faster? That is harder to say. And if you just did red light therapy on your own, it's probably not going to completely cure you of what that thing is. And I think that's with modalities, that's a big issue, because the reason people get hurt majority of the time, not always, our movement patterns and mechanics and the way that we move. That's why therapeutic exercise is so effective.
Yeah.
If we don't change the way that you were moving or how you were doing something, we never change the mechanics. So you're always going to revert back to the problem that was causing the pain in the first place. That's the problem with a lot of these passive modalities. They don't train movement patterns and change the way that caused the problem in the first place. So yes, it might take you from symptomatic to asymptomatic, but that's the same problem that medications have and things like that. It's like, okay, well, it made you go from symptomatic to asymptomatic, and now we go back to our regular daily lives. In the way that you were moving, we never addressed that, and now you're symptomatic again, right? That's the problem with passive modalities. You need to change the way that you're moving.
Yeah, they don't address the root cause.
You got to address the root causes. One of the other ones that I've seen floating out there is there's some claims that red light therapy can like help with like weight loss or fat loss. And I mean, you got any thoughts on that?
No, but I would say stick to the typical things you should do for weight loss, right?
Yeah.
Exercise, diet, sleep, hydration. I think those are, like we said, like the gold standards. I don't know about this being solving the root cause of, you know, why someone is gaining weight.
No. Like, again, passive modalities. You're not, your energy consumption isn't drastically going up because, you know, you're doing red light therapy. There's much better things to be doing. You know, and then the other consideration when you're doing a modality like this are like, what are the risks and what are the rewards? And one of the risks around red light therapy are relatively low. But I mean, just some of the things that you have to take into account to watch out for when you're doing red light therapy are, you know, skin irritation is one. Any others there? Like,
well, if we talked about the wounds, right? So I think the parameters, right? Making sure that you're not going, like, penetrating too deep through that wound. If there's an infection and whatnot, I think that that's a precaution that you should be aware of.
Right. And then just like anything else, you can underdose it, you can overdose it. What is the therapeutic dose? And I think that's an issue with a lot of like the commercially available things, is there's like no way to modulate what the correct dosage is. Is it even intense enough to get the effect that you want? Who's grading that? It's not FDA approved. Like, is it just a red LED and it's not doing anything for you? Like, you know, that's my thing with like these commercially available things. Like if it is supposed to be medically, you know, viable, the fact that it would be open to commercial use, normally there's some risks and parameters to work within that prevent it from being commercially available. So if it is, I'm always a little more skeptical about something like that. Because that either means it's probably underdosed or just not effective. And there's like no risks at all because it's not doing anything at all.
And these machines aren't that inexpensive either. So you want to make sure that the pros outweigh the cons, you know?
And like, you don't want to be blasting yourself in like the eyes with these things either. Like that was one of the, like, I was looking at one of the precautions, like, don't put this in your eyes. You're like, really? Well, nowadays you need a warning label for everything. So, you know, don't shine it in your eyes. You know, there's always the potential for like burns with high intensity use or prolonged use.
Yeah.
You know, if it's making your symptoms worse, obviously don't do it. And if you have like photosensitivity, like that's always been an issue with like light exposure or something like that. You know, don't do that. And any other like medical conditions, like if you have active cancer is like always a contraindication. Like just don't do that. Other than that, it's typically considered like pretty safe relatively. You're not running the risks that you would normally with some of the other things. But like alternatives to red light therapy, like what are some alternatives? We always have the standard of care, right? And that's you know, medicine and physical therapy and things like that. But then you're looking at some of the other stuff for like skin health. I think that's just like, you know, whatever the dermatologist would normally recommend, like the creams and things like that. And peptides. You know, another question, you know, if you are going to do one of these like red light therapies or any other modality, really, it's like how long do you need to be doing this? What is the frequency, the dosage, like all of that? Like how long does it take to see results with the red light therapy? That kind of goes back to what we were talking about earlier. Like I'm doing this, and this is what a lot of people ask themselves. I'm doing this. I'm just sitting there. Like, is this even really working? Like, based on the research and the stuff that we were looking at, like, what typical time frame do you see like results in with something like that?
There was a time frame. I think it was like 4 to 12 weeks. I believe.
Yeah, that was about
really see some kind of improvement or some kind of change.
Average.
Yeah, but then, you know, like you said earlier. Was it just time? Was it just everything else that you were doing in conjunction with it? Or was it just the modality itself?
Right. So. And everybody's a little bit different too. And like, you know, the variation between people and what they like are exposed to. I mean, you see with people who like exercise, some people like exercise a ton and they never gain any muscle. And then like other people like look at a weight and they're like, I'm already stronger. Everybody's different. So it's going to work a little bit differently for everybody. That goes the same for like modalities, just the same as it is for like exercise. Like we have fast responders and slow responders and all sorts of stuff. If that is something that you want to do, are there some certain considerations you want to take before doing like red light therapy or anything like that?
I mean, I think like you said, you know, if you have to look at their past medical history, right? If they have cancer or anything like that, that would be a red flag or contraindication to doing it. So I think asking the appropriate questions, you know, like the skin allergies, if they have any irritations to anything already, that might be something that you might want to be on the lookout for. Exactly.
Yeah. You know, I think at the end of the day, if that's something you want to like try to pursue and you have access to it, that's fine. Like, you know, we don't do any of that at our clinic. So, you know, I'm not opposed to it if that's something somebody wants to try, but I'm not going to make that a bulk of the treatment. And, you know, it's definitely an adjunctive thing, right? So let us know what your red light therapy questions are. Is this something you tried? If you got good results with it? I primarily seen it in the dermatology space, not so much for like musculoskeletal, but I know some more athletes are trying to use it. But again, that's their job. But if you guys have any questions about it, let us know in the comments below. Like, subscribe, share, click all the buttons everywhere. And again, this podcast is brought to you by today's sponsor, us. So Resurgence Physical Therapy, if you're in the New Jersey area, reach out to us and we can help you out with any of your orthopedic problems. And if you're just looking to be healthier in general. So that's it for today's podcast, and we'll see you next time.